Hi, everyone, and welcome to Real Life Talks. I'm your host, Yvonne Heath, author of the book Love Your Life to Death, and founder of the I Just Showed Up movement. So I am so excited today. I have a kindred spirit on the show with me today. I feel like we're already soul sisters. I do, Laurel. And I'm just absolutely thrilled to introduce Laurel Gillespie. Laurel, your bio and everything that you've accomplished in your life, that could be the whole show, but we're just going to share a few things so that we can actually have a conversation. So Laurel is the Director for Advanced Care Planning Canada with Canadian Hospice Palliative Care Association. She's a social justice warrior for disability rights. I love that. And in particular for autism, and a breast cancer survivor warrior. And yes, you should get a costume for that. and Laurel is absolutely someone who proves that not all heroes wear capes, although sometimes they do. To see everybody. I actually did have to wear my cape today, but sometimes they wear amazing superhero dresses, which, Laurel, we have to talk. Oh, yeah, look at this. Thor, Captain America. And of course, proving that even when we have to have meaningful conversations about life, end of life, we can still do it with heart and humor, right?
Absolutely. Yvonne, and thank you so much for graciously inviting me to be a guest on your show. I'm delighted and really very humbled to actually be here today talking with you about this really important issue and bringing advanced care planning to the forefront of conversations today, especially given the times that we're living in. It's more important now than ever, has been before. Mm-hmm. So thank you for this opportunity to share our endeavors, our common endeavors about planning your life, and a life well lived is a life well planned.
Absolutely. And I am so delighted that we've connected. And it's so interesting because we are having this conversation. It happens to be we are in the middle of this pandemic, COVID-19, and people have been navigating some of the most challenging times of their lives, and many people have faced the death of loved ones, and it has been so challenging they weren't even able to just show up. As I tell people, when someone is in the dying process, just show up, and they weren't even able to do that in person. And talk about excessive suffering and grief, and so many people don't want to have these conversations. And yet I say the best time to talk about plan and prepare for grief, death, and dying is when we are young and healthy, and the next best time is now, right? We already
Absolutely.
have enough going on. Yes, we already have enough going on. So let's have these conversations. So I know one of the great things that happened because of COVID-19 was you were not able to have your in-person event in Ottawa. So you created this wonderful fireside chat, right? So let's talk about the fireside chat and talk about bringing in heart and humor. It was wonderful.
Yeah, it was a bit of a trying time. So Advanced Care Planning Day in Canada actually falls on April 16th each and every year. Fingers crossed that maybe we'll get that bumped up to a week, maybe even a month sometime in the future. So this year I had a number of really cool projects on the go. The song Say was going to be released on April 1st. Behind the scenes documentary that was filmed out of the United States, hosted by Lawrence Fishburne, was supposed to be out April 1st. And all of these things were delayed. In hindsight, we still have those. It's like the gift that just keeps giving, because advanced care planning, we're just keep rolling out all these things as they do become available. But we really had to think outside of the box. And, one of the things I think that with this physical distancing was the dire need for people to have a feeling of connection. It's quite scary. And what we fear are the things we don't know. And there's so much we didn't know even back we don't know today, but back in April, it was a very frightening time because we were all being told to, become reclusive and stay in your home and don't do this and do it this way. It was very overwhelming. So we did have to cancel our plans and right the way across the country because there weren't any opportunities to have events that would take place in person. And one of the things I thought, and fireside chats, and this goes way back, long time ago. I believe it was Roosevelt that started fireside chats to be over the radio, to be a very calming opportunity for people to really hear a message about what was happening. And so, it was cooler in April. So I put on a nice fire, and my partner, Sean, was a big help and instrumental in carrying it out. But we connected with Zoom, and we created this wonderful open forum to people to be able to connect and ask questions, everything you ever wanted to know about grief and advanced care planning, but were too afraid to ask. And then that rolled out into the second one because people responded to it so positively. And we brought in yourself again as guest. And so we had you as the grief person, myself as the ACP, but we brought in the comedian to try to bring light and humor. So we actually hosted the second one on May the 4th. May the 4th be with you. And it was what a ducks and grief and elephants, because you talk about the elephant in the room and comedians have in common. And we had a great time. We haven't done another one, but who knows, maybe we'll do another one soon.
It was so actually fun and meaningful. And I think that is one of my greatest messages, right? We have grief and joy, they coexist. And so when people say, I've heard literally in 2014, when I started interviewing people for my book and saying, we need to have these conversations. I hear all the time people saying, well, I don't want to talk about that. Why should I talk about that? And say, I get it. Please don't wait till you want to talk about it, because it isn't a conversation we can avoid for life. And here's the truth. It's very selfish not to have these conversations. I'm sorry. I feel like, who is responsible for planning your life? You. Who should plan your end of life and advanced care plan? You. Mm-hmm. That's who. And so when we talk about, it's a difficult conversation, I am reframing that. What makes the conversation difficult is that we avoid it. And so it is, no matter how small. It's that elephant in the room. You see my little elephant? The elephant's
I see your little elephant.
And my elephant back there who's disguised. It's in avoiding or waiting until we are in crisis.
But again, I think, again, though, it comes out of fear of not knowing how people are going to respond to you, what their reaction is going to be, because it does stir up a lot of very deep, very raw and personal emotions and feelings when we talk about death. But it's the one common thing that ties us as human beings and humanity is that we're all going to die. And nobody ever said, the next time I die. No one has ever said that, because you don't get a do-over. Mm-hmm. So you might as well make, when you were talking about end of life care and goals of care, you want to make sure that your values and your beliefs and your desires are communicated, that you talk to a substitute decision maker, someone that you choose, someone that you trust, that will be able to carry out what your wishes are and making those just difficult decisions when perhaps one day you're not able to do so for yourself. And further to that, Yvonne, it's incumbent upon us to take some responsibility for our own health care. And, one of my fears is that, and having worked at the cancer center at the Ottawa Hospital for 8.5 years, doctors and medical staff, you work your tails off, and people I don't think understand that most doctors and nurses would love to be spending more time at bedside, and they're already inundated with a plethora of administrative papers and things that they have to document. So I'm fearful that, not fearful, I guess, but I would like to see the shift be taken away from it being the responsibility of your physician to have these conversations with you. Take some ownership. Most of us have a better understanding about how our cars work than our own bodies sometimes. So I think it's really up to us to make sure that we promote those conversations, and we at least start them with our medical team, those who are close. But it also comes down to knowledge. And we have to take some responsibility to learn what we can about what prognoses and goals of care look like. But, I also don't want advanced care planning to be slated as all about end of life care, because it's not. It's about how well do you want to live before you get to that point, and what makes your life valuable, what brings you joy, what are the things that matter most to you. Do you want to stay at home one day when you're not able to be cared for, and you have to either go to a hospital or seek medical attention? Do you want to stay in your home as long as you can? And there's some startling statistics, and I'll just share briefly that less than 1 in 5 Canadians actually has an advanced care plan. 80% of Canadians have thought about it. 66% of people in Canada think that it's important to discuss it with a lawyer, but only 6% do. And here's one is 89% of all Canadians could benefit from palliative care in their last year of life, but only 15% of people who died in 2016, 2017 actually had or received publicly funded palliative care at home. And these, especially with this crisis that we're seeing in the long-term care setting, it just absolutely, it's gut-wrenching, it's heart-wrenching. And if what I can do to help promote having these important discussions spares someone from having to go through more suffering and not have their wishes carried out on their behalf when they're not able to speak for themselves, I feel a responsibility to do that. And I'm hoping that I can help to change and normalize that conversation around advanced care planning in Canada. And I know that's what you're all about too, which makes it great. I feel like we've known each other forever, just in the short time that we've worked together.
It's like music to my heart and soul to hear this, because what I love the most about this is that you understand the fear, and you are leading people with heart and with humor, and saying, I know that we are afraid. We're in this together. And you also, the beautiful thing is, the first thing we need to do, and that's where I come in, is say, okay, we need to have these conversations. Why? Because grieving is enough, right? When we are facing end of life, wouldn't it be wonderful to have we don't want to crack codes and try to figure out who did what, and possibly set ourselves up for excessive suffering and fractured families. Mm-hmm. Families fractured beyond repair because everyone thinks we should be doing something differently. We can eliminate that piece, or, certainly choose a better road by having these meaningful conversations before we are facing.
Exactly. Yeah. And don't I know it as the youngest of 8, and having lost both parents and having moved away from where they are. Yeah, it's excruciating, because then you're left with, oh my God, is that what they would have wanted? Did I do the right thing? What was their favorite flower? Like, and this is part of that project with the song Say, was that, you think you know somebody, but do you really know? You know their favorite shows and what kind of music they prefer, and that they like the sound of rain. But do you really know some of their most intimate thoughts and feelings about what brings them joy? Because it can make such a difference. And I don't have the clinical experience that you do, Yvonne, but I know in my experience working in the hospital and hearing that the physicians share some of the trials and tribulations of what they go through and trying to help families, man, it's a win-win-win for everyone. And there's no greater gift, I think, that you could give to your loved ones than having these important discussions with someone, at least, and identifying them, putting your thoughts down on paper and recording it. And there are so many wonderful resources that are free for people to help them do it, like the Advanced Care Planning Workbook, for example. Mm-hmm. We have wallet cards that you can put, here's my, emergency contact, and when I'm just going to shed lightly, because I have a dream, and it's my goal is that one day I would like to see, I have a dream. My mother also taught me, my mom and dad were both very strong social justice warriors. And that's where I get it from, thanks to them. But my mom shared with me one time, and it's a quote by Martin Luther King Jr., and he said, your life begins to end the moment that you become silent about the things that matter. And I can't think of anything better that matters right now in this day and this time is for people to engage and start these conversations, have them, but don't just have one. It's a continual thing. And if I touch on, my own personal experience, and I think there's great value in that. I was 38 years old. I was being seen at the high-risk clinic due to family history, fertility treatments, and it goes on and on. But I was 38 when I was diagnosed with triple-negative breast cancer, and my prognosis wasn't great. I went through a lot of surgeries, chemotherapy, third-degree radiation burns, the full gamut. But I had a 20% chance of making it for 5 years. And I said, I don't care what you have to do to me. Just, I can't die yet. Because my twins are only 9 years old and my youngest is 6, and I'm not finished yet. And I feel so grateful and very fortunate, but that was a turning point in my life. And a few years back, when I went back to school, I had done my master's in business admin and my high-level marketing course. We had to market a product. And I said, well, I really want to do it on advanced care planning. And my professor said, way too complicated. And I said, but I really want to do this. And this goes back to my dream. And that is that I want to see one day across this country that everyone's health card has a QR code or whatever the latest technology is going to look like when it happens, that you have instant access to someone's advanced care plan so that no matter where you are, if you're traveling, it can be accessed. And that's part of the problem with just having a power of attorney for personal care, for instance, is that those documents sometimes aren't readily available. But here's where we are today. We have tools, we have resources like these little wallet cards, the workbooks that are available to download online. There are games that you can play with your family to help stimulate and start these conversations, because they're not always easy. They're not always easy.
I just decided that we needed to go on the road together, right? Because it is just, again, by having that access, imagine, and let me just throw in, my greatest goal is that this is mandatory, just something you become a legal adult, you're 18. Let's normalize that you do an advanced care plan and register as an organ donor. Or are you in, let's just normalize that. Let's not wait, because people say, why should I do an advanced care plan? I'm only in my 50s. And I say, oh my goodness, I'm sorry to be the one to tell you we don't all die of old age and we don't always get a warning, right? Let's just normalize that we do it. It's easily accessible, and we could talk all day. So I just want to make sure that we talk about the fact that on the advanced care planning website, I love that they have the who would speak for you if you couldn't speak for yourself. There's a 5-step. It's a 1 minute video, 1 minute and 27 seconds. And I encourage everyone to watch the video. But can we just go through the steps briefly?
Yeah, exactly. Yeah, absolutely. And we just relaunched our website today, actually, Yvonne, and there's a lovely, under the resources and tools, there's an interactive map that you can just click on your province and those resources, because the laws are different in every province and territory. With the exception of Nunavut, they don't have legislation around advanced care planning or substitute decision making as of today. One day we'll get there. Mm-hmm. But the website is great. But the 5 steps basically is you need to think about what's important to you. What matters? What are the things that bring you joy and bring meaning to your life? And it's about quality over quantity sometimes too, right? I've heard someone say that recently, and I was like, yes, it's so true, because quality of life is vitally important for not just you as the patient, but it's also for those who are the caregivers and the health team that's helping to care for you. So think about what's right for you as an individual. You want to learn about what your options are, and that's one of the things is we don't have a crystal ball. We don't know what the future holds for us, but medical advancements, we have a pretty good idea and what may be in store for us based on diagnoses or prognoses. So you want to choose someone. The 3rd step is choosing someone who's close enough to you that you would entrust in speaking for you in the what if you're hit by a bus, what if you have a sudden massive heart attack or a stroke or a sudden illness, let alone a serious illness or a terminal illness. Those are not the optimal times to start having these conversations. It's now when you're healthy. But choosing someone and identifying that individual and having a conversation with them about what's important to you. And then what you want to do is record what those thoughts are, and hence the workbook that we have. So we have hard copies that you can order from us, but they're all downloadable and free on our website. So then you want to record it. It also really helps to have somebody witness it so that it creates more validity behind it and more weight. And even better if you can have a formal power of attorney for personal care. It just beefs it up that extra little bit. But then, you want to review this continually. So you want to record it and then you want to review it. So tax time, birthdays, anniversaries, dates that are significant to you, because your situation changes over time. So what you might be looking at in high school, which wouldn't it be great if we taught this in high school along with personal finances, would be about life planning, and that it is a natural part of the process of growing up and living a full and good, wholesome, well-rounded life. So you want to then review it on as you go through life's milestones. But the big thing is you have your elephants and I have my ducks. It's so simple. Don't duck the conversation and get them in a row, because that's something you do have some control over, is clearly communicating what's important to you and what matters. And if I can, encourage just one person to do this and share it with their loved ones, those who matter most to them, wow, I see that as a really great thing for people to do, and hope that we and what we do every day, Yvonne, inspires people to get on board with this and get their ducks in a row. Talk about that elephant in the room. And you know what? You can even have fun with it. It's interesting to see how these conversations evolve over time. My daughter and I, my youngest, who grew up very naturally knowing that mom probably was going to die one day of cancer. It's been 13 years, knock on wood. I'm so blessed. I have a great medical team in Ottawa and been very fortunate. But we laugh and joke, and I'm like, okay, I'm starting to get that little, and I'm not afraid to talk about this because this is being real. These are real life conversations, right? Oh yeah, Georgia, do you think you could bring a pair of tweezers if I'm ever not able to take care of myself? Could you just, if you see a little, whisker, could you just, yeah, because that matters to me. Matters at this time, my stage in life. But you can, you really have to look at it and just say, okay, it's the reality. We're all going to die one day. And there's nothing to be afraid of with that. But we want to make it as smooth and as good a possible experience as it can be, not just for ourselves, but for those we love and care about.
Oh, my goodness. We could do an entire full day show, because everything that I'm just hanging on your every word, because I have been that person, part of that the nurse at the bedside when we're awkwardly talking about advanced care planning or end of life planning or powers of attorney when someone is dying. Excruciating. I have been that person talking with someone about, does your loved one want to be an organ donor with your and the family's all grieving around, and that's a conversation you want to have. It's absolutely horrifying. I have made sure, and here's what I say to everyone that says, oh, well, how do I get my so-and-so to have these conversations? And I say, don't start there. Start with yourself. Because it's a lot easier to have an awkward conversation. Walk your talk. Do it yourself first. Figure out okay, so I'm confused about this. Sort it all out, and then approach other people and say, I have done my advanced care plan, and that is a gift to myself and to you, so that our family at that time at end of life, we can support and love one another instead of trying to figure out who wanted what, who did mom want to be cremated or buried, or all of these horrible things that we can have conversations about before, and have that banter and talk about those chin whiskers. Let's just be honest. It's not pretty. Yeah, my daughter already teases me about those things. But anyways, normalize these conversations throughout life. It isn't a one-time conversation. We can normalize anything. We can normalize anything.
It's true. And, and as we progress through our lives and we make our plans and we have our dreams and aspire to fulfill them, this should be as natural a part as your financial planning and your overall estate planning. Not everybody has access to those services, which is another area that I want to work on for those underserviced populations that we have in our country, people who are homeless or live in poverty or, anyway, it's for everyone to participate in. And, when you say it's a gift for yourself, and I recently did some discussion work with Reverend David McGinley, and he said it's homework for the heart and it's homework for your soul. But the really nice magical thing about it is we fear the unknown. When we take control, and this is something we have a say and some control over, it's amazing how light you feel after you've got it. It's like this huge burden is lifted. It's like, okay, I've done it. Now I can morph it into something that'll improve and change over time as we go through life stages. But we buy a house and then we start thinking, okay, well, do I have insurance on my mortgage? And I have a baby now? And you start these planning things, but we can't make that switch. The blinker's on though, and telling you the signal is on to turn that corner. Partly due, if that's a silver lining in all of this that we're experiencing with COVID, is it'll shed a bit of light on the importance of it, and not to just solely put the onus on our healthcare workers, our frontline healthcare providers. As you say, those conversations are so awkward and so tremendously difficult. I can't even imagine, Yvonne, what that must have been like when you are seeing people in pain and suffering emotionally and physically. How it can just remove some of that, lighten the load a little bit off of our healthcare workers who work tremendously hard to deliver in Canada what I consider to be very high level care, having lived outside of the country for 3 years. I'm a strong proponent of our universal funded healthcare system. We can always do better. We can help those that are in the medical community so that they have less burnout.
Absolutely.
That's a whole other conversation.
That is a whole other conversation, and I know we'll have to have more because Laurel, I love your approach. I love everything you do. Thank you so much for just showing up for our communities. People can go to advancedcareplanning.ca for information, for documents, for all kinds of helping them, guide them to normalize these conversations and eliminate excessive suffering. We can do better. We can.
We absolutely can. And it's
together.
It's incumbent upon all of us to strive to do better, Yvonne. And, thank you for the opportunity to share today. Thank you for everything that you do to raise awareness about this important issue. And, it really is as simple as getting your ducks in a row. Talk about that elephant in the room.
Let's do it.
Don't duck the conversation.
Don't duck the conversation, everyone. Thank you, Laurel. Thank you so much. I'm so passionate about this. So thank you, everyone, for joining us for Real Life Talks. This is a show about learning how to just show up for yourself and just show up for others and have those conversations like about advanced care planning. So if you want to be empowered, if you want to be resilient, my call to action is always plan your life, plan your death, and then just love your life to death. And always bring your own tambourine to the party. Bye for now.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Call the Rogers TV viewer response line, email us, or connect with us on social media. This is Rogers TV. Aurelia.
When you don't have the people there to support you that you know you should, your world kind of like spirals. But United Way has been the biggest change coming into high school. Having the ability to help kids succeed is so important.
It's about sharing and caring. It's about doing.